Everyone. This presentation is on Behavior Assessment System for Children, BASC 3. Presenter is Nicola Myrie-Cureteon. The purpose of the assessment and content of the BASC 3. The content. Let's review that. So the social and emotional functioning plays an important role in the development of students' academic skills, and a lack of failure to demonstrate expected appropriate behavior can hinder learning. So it is important for students to adapt to their physical and social environment. Now, the purpose of the BASC assessment is for identification and classifications and intervention planning. And all of these measures are associated with establishing eligibility for special services. 4 methods used to assess social, emotional, and adaptive behaviors. These are direct observation, interviews, rating scales, and situational measures. Now, direct observation is the preferred method because the results are accurate, but it is very, very time consuming. Therefore, it's much wiser to combine all 4 methods to make it more effective. So you would incorporate the interview section, the rating scale section, and the situational measures with a direct observation. For interviews, this is where you gain insightful information into a student's overall patterns of thinking and behaving. And the rating scales, there are several types, but this is where you rate the extent to which the student demonstrate a certain desirable or undesirable behavior, pretty much a targeted behavior that you are looking for. And then situational measures, that could be any reasonable activity, but the most two or the 2 customary methods used are the peer nomination methods and the sociometric ranking technique. The peer nomination is where the peers would actually choose a specific partner that, of their choice, and they will complete the form for that partner or for that person. And the sociometric ranking techniques that includes the parent filling out the information based on their observation of the child in their community and in the social setting or in the home. Now, when we're talking about behavior assessment system for children, or the BASC 3, we're actually looking at functional behavioral assessment. Now, what is functional behavioral assessment? It's definitely an IDA requirement for eligibility for special educational services, and it's used to identify problematic behaviors. Now, the steps for completing the functional behavioral assessment, it includes defining the behavior. So what is that behavior that you are looking for? Give it a name. You have to define it. And then you want to identify the conditions under which the behavior is manifested. Is it mostly in the classroom? Is it mostly on the playground? Is it mostly at a certain time of day? But you want to identify those conditions, and then definitely that will incorporate the antecedents, the setting events, and the consequences as well. And then you want to develop a hypothesis, and after that you're going to test your hypothesis, and based on the results of your hypothesis, you're going to develop a behavioral intervention plan. So what is a specific rating scales of social emotional behavior? When we talked about those type of scales, there are numerous scales that you can think of. But the one for this presentation, or the main focus, is the behavior assessment system for children. What is the behavior assessment system for children? It's a multi-dimensional system used to evaluate behaviors of self-perceptions from ages 2 through 25. In addition, it's a comprehensive assessment designed to assess numerous aspects of an individual's adaptive and maladaptive behavior. What is the structure of the BASC assessment? It is composed of 11 components, including 5 main areas or measurement of behavior. So the areas that we're looking at is the teacher rating scales, the parent rating scales, the self-report of personality, the structured developmental history, and the student observation system. For the teacher rating scales, this is a comprehensive measure of both adaptive and maladaptive behavior that a child exhibits in school and in the caregiving setting. There are 3 different forms available. You have the preschool form, which is from 2 to 5 years old. And then you have the child, which is from ages 6 through 11, and the adolescent, which is from 12 through 21. Teachers, school personnel, or caregivers rate children on a list of behavioral description using a 4-point scale of frequency. So N is for never, the behavior never occurs. S is for sometimes, which means sometimes the behavior occurs. O is for often, the behavior often occurs. Or A for almost always, the behavior almost always occurs. And then the estimated time to complete the TRS is around 10 to 15 minutes. And it can be completed using either a paper and pencil or a computerized format. Next, you have the parent rating scales. This is also another comprehensive measure of a child's adaptive and problem behavior, right? And this is where you're looking for the behaviors it's been exhibited in the community as well as in the home. So the parent rating scale is completed by the parents on a more personal or social setting that does not involve the actual school environment. And this takes about 20 minutes to complete. It has the same 4-point rating scale as the teacher rating scale, where we're using N for never, S for sometimes, O for often, and A for almost always. And then you have the self-report of personality scale. This has 4 different versions depending on the age level. For the first version, this is for ages 6 through 7 years old. This is completed by an actual interviewer, not the actual child. But the older grade levels, the students complete those on their own, and they're answering a variety of yes or no questions. And for the short statements, they are choosing either true or false. And that's going to provide a rating range from never to almost always. And the estimated time here is like 20 to 30 minutes. There's also a Spanish translation for the parent rating scales, as well as the self-report of personality scale. And then we have the structured development history. This is a broad-based developmental history instrument developed to obtain information on the following areas, such as social, psychological, developmental, educational, and medical history. And then we have the student observation system. So this tool facilitates the diagnosis and monitoring of intervention programs, right? So it's divided into 3 parts. The first section, the behavior key and checklist, is a list of 71 specific behaviors organized into 14 categories. Then following the 15-minute observation, the coder rates the child on the 71 items according to a 3-point frequency rating. So it's never observed, sometimes observed, or frequently observed. The second part, time sampling of behavior, which requires informant to decide whether a behavior is present during a 30-second period following each 30-second intervals of 15-minute observation. So this one is a little bit more intense, a little bit different from the rest. There's a lot more going on with the student observation system, because this is actually checking on, or how would I put it? This is actually monitoring the intervention of the program. And these are just pictures of some of the booklets that are used. This one is for the Behavioral and Emotional Skill Building Guide. And these are all Pearson products. If you're interested in getting, purchasing the book to get a more in-depth concept of the BASC system. And here, this is the Behavioral Intervention Guide. Now, for the self-report of personality, this is a clinical and adaptive scale of what to expect. So here is the self-report of personality. Notice that for the children that are filling this out, these are the age group ranges from 8 to 11 for the child, adolescent 12 to 21, and for the colleges 18 through 25. But you do not see the ages from 6 to 7, because that is actually filled out by the interviewer, not the actual child. And they'll just check an X or leave it blank if any of these items pertain to them. Here is the comparison, where you can see the clinical scales and the adaptive scales, and the questions or the items are a little bit different. And here you have the definitions for each of these items. For example, here under the clinical skills, you have hyperactivity. The scale definitions, the tendency to be overtly active, rush through work or activities, and act without thinking. So mother fills this out, teacher, and teacher 2 fills this out, and they give it the score, right? So here for this one, the parent puts within normal limits, going down, right? Aggression, the tendency to act in a hostile manner, either verbal or physical, that is threatening to others. So these are the type of behaviors that are being observed and rated. The psychometric